It's time for a special back to the school edition of Ask the Derm. So we want to welcome board certified dermatologist Dr. Groff from Cosmetic Laser Dermatology here to answer some skin questions, and these have to do with the kiddos.
Right, kiddos going back to school and things that they can pass back and forth to each other, their classmates.
Yeah. Which I'm learning happens very quick, and it happens a lot.
Oh, yeah.
Okay, let's get to the first question. My child is complaining about some painful blisters on his lips. What are they, and are they contagious? This is from Jean from Chula Vista. Doctor, what is this?
Let's take a look. So you can see on the lower lip there's a slight blister or ulceration, and this looks classic for a cold sore, what's known as herpes labialis.
Oh.
Now this is caused by a virus, and this can be passed from child to child, so it's important to tell our children, don't share drinks or bottles of water, don't share lip balm, things like that, no kissing, that sort of thing, especially if they see something like that on a classmate's lip. But these things can even be passed when there's no visible sign of a blister or ulceration. So,
wow.
Most of us have been exposed to the virus that causes these, probably over 80%, so it's not that uncommon, but if we can, we'd like to avoid our children getting these.
Okay, let's get to our next question. This one says, I received a notice from my child's school that one of his kids, in the class has head lice. Are there any signs I should look out for? And if she does have it, what should I do? That's from Anita in Ocean Beach.
Yes, Anita, this is a very common problem in schools, and usually the first signs or symptoms are itching of the scalp.
Is that head lice?
Yeah, this is actually a photo that shows the little eggs, or what are called nits, of the head louse. So they lay these eggs in the hair, and then they incubate for 7 to 10 days, and then they give birth to their little ones.
Birth to their little ones. I like how you say that. They're not very cute little ones, though.
No, they're not. I think we have a picture, and we'll see how cute these guys are in a second. But oh, there he is.
Oh, Dr. Groff, no.
Yeah, that'll
not
scare
on
you a bit.
Babies.
These are actually really tiny. They're only about 1 millimeter or 2 in size. So there are special combs that you can get.
Okay.
Say that you get a letter that your children has been exposed to this at school because one of their classmates has it. Well, you don't necessarily have to treat them, but you want to watch out for the signs and symptoms like an itchy scalp, for example. But you could get one of these brushes and brush through their hair because it will remove the eggs and it will remove the lice as well. So that could be like a preventative way to keep from getting that problem.
I've heard conversations of moms finding out that there's head lice in the school, and they
freak out.
They freak out a little bit.
Yeah.
Okay, here's the next question. My daughter has a few small growths on her stomach that seem to be spreading. She has been scratching them too. What are these, and are they contagious? This is from Anna in Carlsbad. What are those?
Oh, interesting. Anna, this is what's called molluscum contagiosum. And what these are caused by what's called a pox virus, and they are contagious. In fact, if your child is scratching her belly, she can actually scratch and spread them along her abdomen.
Okay.
So it can be really problematic. So there's very good treatments for this, and it is curable. Usually you have to come into the dermatology office, and we have topical medications we can put on these, and it'll make them go away, or we can freeze them with liquid nitrogen. So there's a lot of good treatments, but it can be passed from child to child.
What about child to adult? Can a mom or dad get them?
Yes, definitely.
Really?
Yeah, it's a virus, so it's easily spread from from scratching and then touching. You get it.
You make me not want to touch anybody, Dr.
I know,
Groff.
everyone's going to be homeschooling after this segment.
I know. Okay, here's the next question. My teenage son has acne, but it's not responding to the creams from the doctor's office, and I don't feel comfortable with him taking antibiotics. So are there any other options? This is from Lindsay in is it Carlsbad or Encinitas? Well, whatever.
Yeah.
Okay.
So, I mean, acne is a very common problem. Now, this isn't contagious, of course, but it is a common problem. Probably 80% of teenagers get a mild or moderate form of acne.
Okay.
So if you don't want to use topical medications or antibiotics, and a lot of parents don't, a good safe option that works really well is what's called photodynamic therapy, and that's where we put a medication on the skin, we let it incubate for an hour, and then we expose the skin to a laser and a couple different forms of light. And what that does is it shrinks the oil glands that cause acne and also kills the bacteria. And with 1 or 2 treatments, you can see dramatic results like in that patient that you had up on the screen there.
Affordable to do for the kids?
Well, affordable being maybe $1,000 a treatment. So, but if you look at the cost of medications, particularly like Accutane, it can run into this several $1,000s over a course of several months. So in the end, it can be a more affordable option.
And put aside just the psychological effects that like teenagers go
Oh,
through
yeah,
when you
it's
have
terrible.
acne
Yeah,
and whatnot.
exactly.
Okay, here's your next question. My son just started practice for his high school football team a few weeks ago, and now he's complaining about flaking and itching in between his toes. What can we do? This is from Cynthia in Rancho Santa Fe. What is this?
Oh, Shelly, I'm going to let you take a guess. What do you think this is?
I don't know, like some type of fungus or
There you go. See,
athlete's
you could
foot?
be a
Is it
dermatologist.
athlete's foot or no?
Yes. So this is caused by exactly what you said, a fungus.
Okay.
So great job there. And it's very common. I mean, kids that play football, any sport really, swimming, anywhere where they're showering afterwards, it's really important to have them use those shower shoes or sandals.
Okay.
Because the fungus tends to live on the floors of the bathrooms and the showers and things, and you pick it up, and then it starts to itch, and it really, your feet can get really macerated and chewed up from the fungus. Now it is very easily treatable, but again, something you want to avoid. So shower shoes
Shower
for
shoes.
everyone.
Okay,
Yeah.
all right. Here's the next question. It's been a long summer taking care of the kids, and I feel like the stress has made, oh yeah, this is a good one, the lines between my eyebrows deeper. Is there a safe treatment from these lines? And this is from Carla in Carmel Valley.
Well, first we should give a shout out to all the moms out there that have worked so hard taking care of our kids, because it is very stressful. I mean, dealing with kids 8, 10, 12 hours a day, it really does.
8, 10, 12 hours.
I mean, it's a tougher job than I have, dealing with the kids.
Yes.
So, shout out there for all the wives and moms out there. But the best treatment for the scowl lines or the stress lines is, of course, Botox Cosmetic. And it's amazing, Botox now has been available for over almost 15 years.
Wow, that long?
Yeah. So it works incredibly well, it's safe, and it'll just relax and remove those stress lines. So a really nice treatment.
It's very
with
magical.
no downtime.
No
Yeah.
downtime. No
downtime.
All right, well, Dr. Groff, this is really good stuff. Did we get through all of our questions? We covered a
think
lot.
so,
That
yeah.
was really good.
My kids are hoping that Raul will do his imitation of what a head lice looks like. They like when he does his facial
Raul?
imitations.
Oh,
Perfect.
oh dear.
I was thinking Dr. Groff was running for office or something. Shout out to all the moms out there. Stay-at-home moms, all the great work you do, even working moms, when you come home. Shout out to all of you.
You know what?
Vote for me.
I
Dr.
appreciate a gentleman that can appreciate the moms. I appreciate. High five, Dr.
High five.
Groff.
Thank
You're
you.
awesome.